Hi, Dr. Stoker here with an interesting case. We have a 38-year-old gentleman who's had gynecomastia since he's a teenager. What is gynecomastia? It's when a male has feminine appearing breasts. There are different components to that. There can be loose skin, there can be extraglandular breast tissue, there can be fatty tissue, there can be a puffy areola with poor skin elasticity, and there can be prominent nipples. All of those together or separately can contribute to what we call gynecomastia. It's something I treat very commonly in my practice, but I found that the key thing is, the most important is have the appropriate diagnosis about what is the cause for the abnormality and make sure you've got the appropriate operative plan. It's not so clear even to plastic surgeons. This is a clear case for me. He's got some fat in this area here, but there's also, if you squeeze in this area, you can feel there's a density to the tissue that's different than out here. And that's because there is a little bit of breast tissue, even on a male, that radiates out from this nipple, kind of like the roots on a tree. And what I'm going to do under local anesthesia, it's very well tolerated in my hands, is we're going to numb him up, and through a tiny little nick of an incision here, I'm going to put a tumescent solution in here and then perform power-assisted liposuction. What that's going to do is it's going to thin out all this fatty tissue here and give him a nice flatter shape that looks more like the pectoralis major muscle. I expect though that there's going to be a little residual nugget of breast tissue right behind the areola. We call it retroareolar breast tissue. Through that, and I'll be able to make that assessment on the table after the power-assisted liposuction. What I will then do is make a tiny little incision right at the areolar border here. And because it's loosened up because I've removed all the fat, I'm able to reach in and pluck out a little bit of that ductal breast tissue to give a nice flat contour to the overall breast. It's very well tolerated and it works every time. I'm super excited to get started here. Dr. Stoker here in Los Angeles with a great looking, very early post-op 6-day result. We just took out the little sutures, we did power-assisted liposuction of his chest, and through a little tiny nick in the areola, removed some breast tissue. We've got a great improvement already 6 days out. Obviously there's bruising and swelling involved, but he looks way better than he did just a few days ago before surgery. I'm excited about this early outcome.